Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antech Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antech. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antech Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Just a quick note before we jump into today's episode. Our guest today is Jodie Gerdin, who is employed by Antech. We're sharing this so you have full transparency about the relationships involved.
Well, welcome back to Tales from the Lab, everybody. Today, we are diving into a topic that never gets enough airtime, but affects almost every diagnosis we make in practice, and that's biopsy submission. And who better to walk us through that than Dr. Jodie Gerdin? She is the Director of Anatomic Pathology at Antech. She has been with us since 2015 when she joined as a pathologist. And of course, now she is leading the charge here at Antech for our anatomic pathology division. She hails from upstate New York and is a graduate of Cornell College of Veterinary Medicine. After completing an internship in small animal medicine and surgery at a private practice outside Washington, D.C., she worked for 5 years as an emergency veterinarian, and she did that at a referral hospital near Richmond, Virginia. And then she returned to Cornell for her anatomic pathology residency, where she developed her expertise in hepatopathology and forensic pathology. Like me, she loves tearing through an antique store, brewery, touring in between, and there's no shame here. She is a big Washington Nationals fan, Baltimore Ravens fan, of course. Got to support our local teams. And honestly, I'm just thrilled to have you here, thrilled to have this conversation with you. And I know by the time we wrap this up, we're going to have a lot of really important how-tos to share with the veterinary community across North America. So thank you for making some time for us today.
Oh, absolutely. Thank you so much for having me on. Really appreciate the opportunity to talk about something I think kind of gets hidden behind the curtain a bit, you know?
Yeah. Well, you had a conversation with me and my colleagues a few months ago. And because clearly, we get a lot of samples every day. And if everything came in neatly, perfectly submitted, right, we wouldn't be having this conversation. But I think that we obviously have some of it's maybe what we were taught by mentors, or how it used to be done, maybe, or just that things are more specialized than people realize.
Honestly, I think this just doesn't get talked about enough.
Okay.
Sometimes at vet schools or in other conferences. I feel like how to submit a biopsy, how the biopsy process works, like what actually goes on the lab side is just not something that gets a lot of airtime. Honestly. So,
and now we're getting a whole episode.
Yeah. Right. Exactly. No, so it's fantastic to have this opportunity, because again, I think it's something that that people should understand, kind of like taking radiographs, right? Like, I have a vague recollection from my vet school days about, the intensity and how long you're going to have it open and things like that. And, I had no idea about how a biopsy became a slide and how, results happened literally until like the first day of my residency. Like,
yeah,
I remember being walked around the lab by one of the other residents who was in her final year. And she's like, oh, and here's microtomy stations over here and embeddings over here. And like, I had no idea what she was talking about. I'm like, the what? The who?
Yeah.
What happens at these things? Like, I was, it took a residency for me to really understand. But again, I hope to kind of pull back the curtain a little bit from the mystery surrounding biopsies today.
Well, let's start with big picture. From your perspective, what are the most common issues that pop up with biopsy submissions, where things maybe are going off the tracks a bit, and why do they make such a big difference downstream?
Oh, yeah, perfect. So I think the number one thing that me or anyone on my team, any of the pathologists here, would tell you is that we don't get enough information about what's going on with the patient from the client, or what the vet wants to know. I think there's this misconception that if you tell a pathologist anything about what's going on with the patient, that you'll bias them. And, on the one hand, I kind of I guess I understand where that might have come from. But on the other hand, like, vets in practice, people who practice every day get told things by pet owners, by pet parents that are like, not accurate. Like, oh, he just started vomiting the other day and the dog's like, 5% or more dehydrated.
Right.
And we need information, just like a vet in practice working up a dog who's sick needs information about what's been going on, needs their history. We actually need that same kind of history so that we can interpret the changes we see in the microscope in the context of the patient, right? Because we're not doing, you don't actually want like a pathology report that has no clinical input in it, because it's going to be really dry and it's not going to be very helpful. It's not going to speak to your patient. But the more clients can tell us, the more vets can tell us about that patient. The dog came in for a week history of vomiting. X-rays, were unremarkable. So we did this endoscopy and we got endoscopic biopsies of the stomach and the duodenum, and we're giving them to you to look at. That's perfect. Now I know, like, okay, this dog is vomiting. And if I see something in the biopsies, I can not only say, hey, there's this thing in the biopsies, like, I don't know, there's this patch of lymphocytes over here, but I can then say, that could explain the vomiting. Or I could say, I saw this thing, but that really doesn't explain the vomiting, which is what you're dealing with. So maybe try this, that, or the other thing, or let's look over here. So we really need that clinical history. I think one of the best ways to think about a biopsy is that it's a referral. You're referring a teeny tiny part of your patient to another doctor. And just like any other referral, you want to set that other doctor up for success, that specialist up for success. And, here's the signaling. Again, here's the history and what's going on. And here's what I want to know. Here's what I'm hoping these biopsies will do for us. I know people are super busy. And if there's just one thing to put on, the submission information that you send along with your biopsy, it would be, what are you trying to learn? What do you hope the biopsy tells you? Because then we can answer that question. Like, we read those forms, we get that paperwork. So yeah, that's what I would say is number one.
Number one. And what would be a close number two?
Oh, close number two would probably be shipping and handling. And again, that's going to sound super dry, but like making sure the biopsy's handled carefully, making sure it's in enough formalin, making sure if it's a big biopsy, it's packaged correctly and shipped correctly. Like, all of that stuff is then the absolutely critical number two, because if things go wrong or things aren't handled well, the tissue can degrade, the container can break if it's not,
Right.
one that's kind of been approved, or just all sorts of things can go wrong. And now you have this irreplaceable piece of tissue, this biopsy that you've invested time and money to get from the patient, and it's degraded or lost. I mean,
and I have a lot of questions about all of that. I think
Sure.
before we even get into packaging and shipping, I think from my perspective, I mean, obviously every veterinarian that's listening to this wants to set you up for success. So,
Right.
or set the sample up for success, I should say. And your ability to interpret. So, what's happening in that first few minutes after a sample collection that can make or break the final result that you're able to give the veterinarian back?
So the minute the tissue is removed from the patient, it's cut off from its blood supply, it's cut off from nutrients, and it starts to degrade, right? So we want to stop time. We want to put it in formalin. And that's basically how I think of formalin is stopping. It stops time. It stops autolysis. It stops bacterial breakdown. It stops all those types of degradation. So the sooner you can get it into formalin, and it's got to be enough formalin too. The recommendations are always 10 parts formalin to 1 part biopsy. So that can be, depending on the size of your biopsies, that could be a fair bit of formalin. And we'll get in later about how to handle some of those larger samples. But for your basic biopsy, like skin biopsies, endoscopic biopsies, small masses that you're removing from the skin or sub-Q space, those can all go into an adequate, volume of formalin and be shipped to the lab. But you want to do it quickly. The high rates of air circulation, like the HVAC systems in ORs, often can dry samples out a bit.
Okay.
Even surgical lights are pretty warm. And if they sit under surgical lights, you can get some degradation there. One thing I know a lot of people tend to worry about that's actually not as big a concern is electrocautery.
Okay.
So electrocautery does sort of, fry the edges of the tissue sample. But that's okay if your sample is anything larger than a couple millimeters. That's not something that's going to interfere with our ability to interpret the sample. And in fact, sometimes it's even handy because for sure when you see that, what we call cautery artifact, when you see that little bit of burn basically on the outside of the tissue, you're like, oh, that is definitely their surgical margin because that's where they've cut it. That's where they've taken it out of the patient. So
you can use it to your advantage.
That's not a terrible thing. Yeah, absolutely. Yeah.
Well, and I mean, obviously, we've already spoken about the volume consideration. Are there any other things on that mental checklist that a veterinarian should be going through when they're thinking about the container or the
absolutely. So size matters when it comes to biopsy sizes, right? And shipping matters. So there's a cap on the total volume of formalin that is safe to ship and that can be shipped safely. And that's a liter. So, if you think about like your water bottle, it's basically the size of your 1 liter water bottle. And any container larger than that, or if you need a container larger than that, you're probably gonna have to ship the sample fresh. That's kind of the next best thing. But in terms of biopsies, again, that need a liter or less container size, you want to always use something that's purpose designed for biopsies. And what I mean by that is it'll be a plastic container, so it won't shatter like glass. It'll have a wide mouth. Fun fact, when you put tissue samples into formalin, they actually get firm, a little more rigid in those 24 hours or so that they're sitting in there to fix. And if you put things in like, a mayo jar or something that has a more narrow neck to it, it can be sometimes even impossible to get that sample back out of that jar. So and
give us some
it pains
room.
me almost. It pains me almost to say because I'm all about reuse, recycle, but do not reuse, do not recycle when it comes to plastic containers. And even things like Rubbermaid containers with large tops, et cetera, like they don't screw on, so they're not safe. They're prone to leakage. And none of these containers that we're talking about are properly labeled either. So if you get, again, a purpose-designed biopsy jar, it's going to come pre-labeled with what's in it about formalin, along with the appropriate markings. And again, and a nice little sticker space to put the patient name and information on it. So those are available through Antech and lots of other distributors of equipment and lab supplies, et cetera. But I know you can get ones that'll work just perfectly for our lab through Antech. So.
Now, when you say everything comes back to the size matters in the world of what if let's go to the small end of the extreme first. Okay. Mm-hmm. So when we're talking about those little biopsies that are the who knows? Size of a freckle or whatever. I mean, I imagine every once in a while you get this tiny little thing that's floating in a big vat of formalin, and you're like, "What's even in here?" So, what should we be doing?
Right. So, ideally, if you're getting something that's, let's say, even under like half a centimeter, and that's not, in a tiny, tiny jar too, you should be putting those in a cassette. Alternatively, so there's cassettes with mesh. Those are my favorite. Those are great. And they're honestly also the easiest in terms of handling. You just put the biopsy in the mesh cassette, get them all in there. Like if they're endoscopics or nasal biopsies or cystoscopic biopsies, urinary bladder biopsies, put them in there, close the lid, and you're done. Alternatively, you can use cassettes with sponges. The sponges, however, and this is another secret no one ever tells you, the sponges should be pre-soaked with formalin. Otherwise, they can kind of stick and cause a little bit of damage to those biopsies. And if they turn out to be especially small biopsies, that can really impact what we can see and the quality of the biopsy as a whole. So I really recommend those mesh cassettes over the sponge ones. Because again, you got to pre-soak the sponges and that just takes time and it's a pain in the butt.
It's just an extra step we don't need to necessarily worry about if
100%.
we're using
exactly.
okay.
The mesh cassettes. Yeah.
Okay. And I think that this is probably an area where I think more people are maybe getting it wrong, and that's when we have massive samples, right?
Absolutely.
A whole leg or whatever it may be. So
whole spleens. Yep.
Whole spleens. So break this down for us. What do we need to be doing?
So if you've got a sample that's going to need to be in a container that's, again, over 1 liter of formalin, like the whole volume of the container of 1 liter, not just the sample, but everything together, then you're probably looking at shipping it fresh. And I use fresh in air quotes, which you can't see me making, but that's the word pathologists use to refer to everything that's not in formalin. So I do want to be 100% clear there. It's not exactly fresh, but yeah, it's fresh to a pathologist. What that means is you're going to want to put the whole spleen or whole limb, and we'll use those as examples because, right, those are super common submissions to our service. You're going to want to keep it just a little bit moist, not soaking wet, but moist, so its sample doesn't dry out. And the best way to do that is with a couple of paper towels or gauze that's been moistened with saline. And then you're going to put the sample, so the spleen or the limb, with some of that gauze to keep it moist, in a plastic bag. And you want to then triple bag it and keep it in the fridge until it's time for pickup. That is the best way to handle those submissions. If you happen to have another veterinarian or a technician or somebody on your team who has the interest in pathology or lesions and wants to take some pieces out of those, that spleen or that limb, you can do that and pop those subsampled bits into some formalin and then ship them all together. But we're always going to want, again, if you're removing it from the patient, you should be sending it to the lab. That's always our recommendation, because what you don't want to get is to a situation where you're like, oh, I think this is the problem area, and you send it to us and we say, it's not the problem, and it's maybe this thing that happens with old age or this other thing, but it's not what you were looking for. But then, oops, the rest of the spleen or the rest of the limb was in, the dumpster.
Already gone.
Yeah, exactly. So you can take a little subsample if you want, throw that in formalin and submit them all together, but always send us the whole limb, whole spleen, whole whatever it is that you're taking out, no matter the size.
Great. So let's talk labeling now, because I know that we have these cases where it can either stay beautifully organized or it can go boldly off the rails in some cases. What does good labeling look like? What are people forgetting to do?
So best practices with labels are always to label the jar and not the lid, because lids can be accidentally switched around. You want to label the jar, so like the side of the jar. And again, those purpose designed biopsy submission jars will have the label on the side and not on the lid. So you want to start there. Let's see. You also always want to keep all of one patient's biopsies together. So let's say you've got a dog that's got like 5, wart looking things on the skin, and you take them all off. You want to put them, if you want to know which one goes to which site, like you want to know, okay, I want to know what the one on the head was. I want to know what the one on the right shoulder was. Put them into separate jars, separate biopsy containers, and label them, head, right shoulder, left hip, etc. That way we know when it comes to the lab, because we can't tell just by looking at a little piece of skin, like, oh, where did this come from? We don't know. So we're relying on you guys, the vets out there, to tell us where you got the sample from. Always keep a patient's samples together. You always want, just like a doctor never evaluates only part of the patient, right? Like I don't just look at the left ear and that's it. I want to see the whole patient. As a pathologist, I want to see all of the patient's biopsies. If you're taking them off at the same time, if you're getting those samples at the same time, or even with a couple of days of each other potentially, get them together so that I can interpret them together, because that can make sometimes a real difference in a case. So you would put all of those jars together into one, with one submission form, and keep them together like that.
And labeled on the jar.
On the jar on the side.
Not Don't use a washable marker, please. Right?
Yeah. No, pen is usually sufficient for the side of the jars.
Yeah.
That usually works out. Yeah. And make sure the lids are on tight. Yeah,
for sure. Yeah, and I guess that brings us to shipping and all the challenges that come with that. Leaks. We've heard about this many times as a PSV team at Antech. Breakage of jars. These end up causing regulatory problems too, right? And shipping problems.
So
what can we? I guess just tell us some of your horror stories, I guess. And
oh gosh,
tell us some of your favorites, and then also just what are the common things that go wrong, and what can we do to just make it go seamlessly next time?
So I hear about the horror stories secondhand because they don't make it to me and my team. They don't make it to us, So the horror stories that you hear about are anything leaking,
right?
Unfortunately, the people who are shipping these things don't understand what it is, and sometimes those samples it's not like they will repackage them or that they can do that. So sometimes those samples are simply lost, especially if enough fluid is lost, they dry out, et cetera. And you've lost your biopsy. I mean, that's the biggest horror story is the biopsy is toast. It's not usable anymore for diagnostics. That's the worst case scenario. You can avoid that again by using purpose designed biopsy jars, or again, for those extra large submissions, triple bagging, and having the paperwork on the outside nice and visible, and just keeping the histo stuff together. If you've got a patient that you took biopsies and blood from on the same day, submit the blood with a different submission form. It goes to a different part of the lab anyway, and keep all your biopsy stuff together.
Great. This is just a curious question that I had, and I remember you sharing some of this with the PSV team a while ago, but I just think it might give people a chuckle if you could tell some of the more creative submission containers you've seen or
recycling. Oh man, I mean, so my favorite. I don't like to actually see this when it comes to the lab, but it does give me a chuckle. My favorite is the extra large animal cracker container that is shaped in a bear that comes with a large
a red plastic
spleen in it, or you name it. You name it. People have tried to use it, and again, and I get it because it's like, man, I want to reuse this plastic container too, right? Let's all do our part and save the earth. But
you could just imagine in surgery, the vet just saying, "Hey, find something big enough for this spleen," right? And
right. Yeah. No.
And they go to the break room and find their animal cracker container.
Right. Right. I think the worst is probably plastic shoe boxes and stuff that have no sealability whatsoever, and people try to tape them up and it just doesn't work. Don't try that, folks. Don't try that at home.
Please.
It doesn't work. You're going to lose your biopsy, and nobody wants that.
No, that's our diagnostic gold, and we have to treat it as precious cargo. Right.
It's true. 100%. Absolutely. It's literally irreplaceable. There's so many of these things that you don't want to have to deal with the loss of a biopsy.
Yeah. And you've seen tissues submitted with gauze, cardboard, tongue depressors, right? I think you said.
I definitely, I think there's a lot of, I don't know, again, when I was trained, I was told to do this, that, and the other thing. And honestly, there's not a whole lot of preparation that you need to do for us. Again, gauze for the extra large biopsies, that gauze that's been moistened with saline helps keep the sample moist and avoid drying out, and that's fine. And gauze is also easy for us to remove, but you don't need to pin or stretch out anything on cardboard or on tongue depressors. In fact, saying the word pin made me remember. Please do not put any sharps in with your biopsies. The personnel who handle these are not expecting those. And honestly, also by the time the sample gets to us, that formalin's often really brown and opaque. And it's, it's kind of a mystery as to what's in the jar. So we've got people reaching in there blindly, with gloves on, but needles go right through gloves, as we all know, unfortunately. So,
and this is not theoretical. Please. This is something that has happened to folks. So,
oh yeah, a couple times a year. Yeah. And getting a needle stick with something informal and that you don't even know where, what the diagnosis is not a good day
Of
for
course not.
anybody. So no sharps, people.
No
Please.
sharps.
Don't send sharps.
What about samples that contain metal implants or hardware? What special considerations do we need to think about there?
Yep. So if you've got, the most common scenario is that, there's a patient who has a limb amputation and that limb has a plate or orthopedic wire. It had a history of orthopedic intervention, and there's some hardware, as we sometimes call it, in that limb or in that sample. That's obviously really challenging for people to try to remove in practice, and you don't need to do that, but you do 100% need to let us know it's in there. So writing on the submission form or typing on the submission form, like in all caps, making it as large and obvious as you can to the technicians in the lab who are receiving that sample, that there is metal in there. Because for things like bony lesions, we use saws, band saws, often like, high-powered, machinery to get that sample, get a nice cross-section of the lesion. And if they don't know that there's a plate in there, it can be a real hazard to our staff. So just let us know, again, as well as you can on the form, that is in there and that we know then to expect it. And they'll do a lot more than dissection down first before going in with the bandsaw, so they can isolate where that orthopedic metal and such is. Yeah.
I think we've addressed most of the scenarios out here that might present a hiccup or a moment of questioning. But if there is a practice that's ever on the fence, unsure about how to package something, how much fixative to use, or whether there needs to be some special handling that goes into this, what should they do? Is there a resource that they can call?
Yes, easy peasy. Yep. So call customer service. Customer service does have a lot of guidelines that can help you navigate, what might be best practice for your situation, for the type of biopsy you're taking. But if they can't, there's a channel that they can escalate the call through, and it'll come to me and my team, and we can give you a call back or email you back, whatever your preference is, to get back in touch with you and answer your questions about how to get the biopsy. We are so happy, let me tell you, to answer questions before you try to send something in, and so that we can help you get it right, than to try to send something in and, kind of maybe have to guess at what you're doing or guess wrong. We are happy to help you get it to us and accommodate whatever situation you're in. We've got clients from really cold climates, and we've got clients in really hot climates. I mean, it's like 80 degrees in Texas today, and you can't just leave your whole spleen out in the box in front of the clinic all day. So if you're in a challenging situation, again, in terms of pickup or the biopsy size or the biopsy type, we can work with you to figure out how you can get the best samples to us so that we've got the best chance at getting you a real confident answer. So we're happy to work with you through that, or even approaching like a biopsy, like, oh, the patient has this, what size needles should I use? What size punches should I use? We can give you all that information. Should I scrub beforehand or not scrub? When do I take them off of prednisone or other medications for dermatologic conditions, especially that might interfere with biopsy, things like that. Happy to field all those questions. Because again, it doesn't get enough airtime. People just don't know much about pathology, and that's not anyone's fault. And we're here to just help you guys get the results you need.
Well, let's talk about your team, and let's talk about all we have the preferred pathologist program at Antech, and we have a specialists almost in every area of pathology, right? Brag about your team a little bit, because
Not
I
hard
think
to do.
Right.
So we've got a team of 45 board certified pathologists. Some have been with the company, a number of them have been with the company for over 20 years. And we've got, newer people on the team too, people who've been with us just a year or two. And we have a real range and breadth of experience and interests. And I think that's what I love most. When you have those people fresh out of residency, man, they are whip smart. They know all the latest information. They know all the latest techniques for IHC and things. And when you've got the people who are really experienced and have seen, I kid you not, hundreds of thousands of biopsies. In some cases, they're like, oh, this is like the 30,000th mast cell tumor I've ever seen.
Right.
Those people are so good. And they can also help guide, some of our younger pathologists too, about what to focus on or what to not get distracted by, what's important and what's not important, that sort of thing. So that's just the team in general. And they're fantastic. Within that, something that I think is important is that, as veterinary medicine gets more and more specialized, so does veterinary diagnostic pathology. And even within, dog and cat surgical pathology, which is, the majority of the cases we see, we've got teams of pathologists who specialize in certain body systems or processes. So
Right.
what do I mean by that? So we've got a dermatopathology team. So they are experts in canine and feline inflammatory dermatological conditions. And I'm laughing because that's like my Teflon. I had a really great training in derm path, but man, it's a challenging area. And so I'm always like admiring the derm path team because what they do is not easy, at least in my mind. And so we've got that team. We've also got the liver pathology team. That's something that did stick to my brain, thankfully, when I was in my residency. There's a lot that's happening, a lot of conditions that we didn't recognize maybe 10 years ago in dogs, like ductal plate malformations and things like that, that we've got people experienced on the team to diagnose. And so I think that's a really great service. But again, I'm biased.
That's okay.
We've also got the pet cancer team. So this is a bunch of pathologists who are, again, have expertise and more experience in dog and cat neoplasia, especially things like splenic diseases, round cell tumors. Those can be real challenging diagnostically, things that especially get into needing testing like immunohistochemistry or IHC. And then we've got the oral pathology team. And they are experts at, things in the mouth are funky. They're different. They're weird. And thank God for them, because they have such an incredible talent, and they know, again, the entities that are a little more rare that are out there, and they're able to make those challenging diagnoses. We've also got a number of pathologists who are interested in exotic and zoo species. So
we always get questions about that.
Yeah, exactly. If you've got a ferret, you got a rabbit, yeah, absolutely. Like we've got people who are well equipped to handle that and really love, honestly, it's kind of like the highlight of their day because we don't get a whole lot of those. So it's like, oh, I got a hedgehog, like this, it's things that we love to see. We also have an ocular pathology team. So if you're doing an enucleation, so kind of like the mouth, eyeballs are their own special thing. They get different diseases, there's different terms for everything in the eye versus everything else. So got a team of pathologists who really enjoy ocular pathology and are really good at it. So we leave those things to the experts. The all eyes that come to Antech, now this is just Antech specific, I want to be clear, not true of all labs, but for Antech, if you send us an entire eyeball, that will go to the ocular pathology team. Or again, if you send us an exotic animal, that only goes to a pathologist who has said, yes, I want to look at things that aren't dogs and cats. So that's all automatic and on the back end. If you want to get a biopsy to one of the specialty teams, again, in liver, skin, feline and canine neoplasia or oral pathology, there are biopsy test codes to order that will direct the biopsy just to that team. And that's the only way to kind of get them guaranteed. Otherwise, it goes to the first available. That's our
and
default.
then for the general case, or I don't know how we would say that, a non-specialized case, we have the standard case, preferred pathologist program. Can you explain a little bit about how that works?
Absolutely. So sometimes it's really helpful to get to know your pathologist. And I think it's always helpful, but I know it's not always realistic for everybody. But if you would like to get to know your pathologist, get to understand, their reports and just be able to pick up the phone and chat with them, the preferred pathology program is for you. So this is a program where, depending on your hospital size, basically, we'll help you pick like 3 to 5 pathologists, And those pathologists will be just assigned to your hospital. So any biopsies that you send to Antech will go to one of those people on your team. So again, you kind of get a feel for people's reports, and again, and you can get to know them. That's the driving thought behind that program, and as pathologists, we enjoy it too, because I will tell you, and this is so silly, nothing brightens my day like a little note from somebody like, "Hey, Dr. Gerdin, hi." Yeah, like it's like people will write like notes on the submission forms, and it's just great because you're like, "Oh,
Yeah.
I feel seen." I don't know. It's silly.
It's like having a pen pal back in the day, right? Sort of like
it is. Yeah. Oh my gosh, absolutely, yes, it is, and like, and you know, and again, we get a rapport going, and you can be like, "Cat was not easy to work with. Sorry for tiny biopsy size," or something like that. And you're like, "Okay, cool. I get it." It's fun to have, I don't know, it's fun to have that connection with your clients. We enjoy that, I think as much as.
So there's no policy against a happy Post-it being.
Oh, please. No. Yes. Send us all the happy, put stickers on there. Oh my gosh. And I love the like holiday themed paper, like around like, the holidays, or like, heck, for St. Patrick's Day or whatever, like so print out that submission form on some stuff with clovers and leprechauns, and just it really brightens my day. It's just different. It's fun. It's like when pet parents bring you candy. Come on, man, who doesn't love that? This is like my candy is like a note to me, like hello. That's
absolutely it. Well, it's serious business that we're involved in every day, and just to have bring a little heart and humanity to it. Feels good.
Absolutely, it totally does. Because again, we're so focused on like the cells and the tissue patterns we're seeing and things like that, and you're like, oh yeah, there really is somebody on the other end of this piece of paper.
Exactly.
It's humanizing. I think that's
we all need that.
100%.
Well, we're gonna wrap this up, but I just want to make sure as we leave our audience with this episode to think about if they could walk away with your top takeaways for a stress-free pathologist approved biopsy submission. What are the meat and potatoes of what you hope sticks here?
Yeah, I think I'd break it down by saying, if you're not sure how to get the biopsy or how to submit the biopsy, call us. We'll help you get it to us right so that it comes here in great condition and we can get the most out of it. Tell us something about the case. It's a referral. You're referring a teeny part of your patient. Pretend we're another veterinary specialist, like, tell us something about the case. Tell us what you want to know. Ask, write a question on the form. Is this? How about this? What about this?
Yes.
And then one thing that we didn't get to is if you get the report back and you have more questions, or just like, I don't know, that doesn't fit with what I was thinking, call the pathologist or email. Honestly, I think email is a really great method of communication, because we do have people across the US and in Canada. And that's the best thing to do, is to talk to us. Our jobs are to make sure that we're relaying as much information we can, as clearly as we can. And if you think there's something that we didn't consider or something that we didn't like look at or what have you, just call and ask. I wish people talk to us more. Honestly, I think that would be a wonderful thing and be a benefit for everybody.
Well, I would love to talk to you more as well. So will you come back? Will you come back and do another episode with us? Good. I know Holly.
Part 2. Love it.
Yeah. Holly will be here to join me for the next one. I'm sure of it. We'll have you back as many times as you want, because I think that like you said, we don't talk about it enough. And I think that there's so much to learn. And we've just scraped scratched the surface of this. So
it's like we did a skin scrape, and that's not even really pathology. That's like cytology.
we gotta go deeper.
We gotta dig right.
No, thank you so much. This was a lot of fun. And thank you for everything that you do for our team at Antech and for our patients across North America. We really appreciate your hard work.
Yeah. I'm happy to act as like a tour guide to the land of biopsy, because again, I don't think it gets talked about enough, and so happy to be here and happy to do it again. Yeah.
Great. Well, here's some more conversations in the months and years to come.
Fantastic.
Thank you very much, Dr. Gerdin. We appreciate it. And we'll see you next time on Tales. I almost forgot the name of the podcast.
Having so much fun, going blank.
And and I asked them not to put the bloopers in. They said they're going to make a blooper reel one day, but they always put my mistakes in. I said, what'd I say? Healthy as a clam instead of happy as a clam, or healthy as a horse.
Oh my gosh.
So healthy as a clam, and it's going to end up being a t-shirt or something. So
dude, in Rhode Island, that would sell.
Yeah.
I'm telling you.
So Tales from the Lab is the name of the podcast, and we'll see you next time. Thanks, Dr. Gerdin.
Thank you so much.
You bet.
Bye.
Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.